Dzień dobry, and thank you for having me today. I'm very happy to join Forum eZdrowia, and I see very interesting topics on the agenda and great speakers, and I really believe that all together we can make a difference. The COVID-19 pandemic showed us how a healthcare system crisis can lead us into social and economic crises as well. But I think that thanks to joint forces of healthcare professionals, governments, the pharma industry and many others, we can emerge even stronger from this crisis. So thank you all for your efforts. We can observe that one element that really helps us in this context is the digital transformation of healthcare and the pharma industry. Digital health is also one of the EU priorities. That is why today I'd like to talk about new opportunities for Europe, new opportunities for Poland. We're currently in a very difficult but at the same time interesting moment due to the digital transformation of the healthcare and pharma industry model. I believe that everyone has the right to have access to safe healthcare at a high quality. This is a fundamental human right. But at the same time, we are faced with challenges all over the world that do not allow us to fully implement this right in practice. I'm thinking here about growing and aging populations, chronic disease outbreaks, increasing costs, staff shortages, and also the COVID-19 pandemic. Taking into account all these factors, I see that digital transformation of the whole healthcare system as a real and efficient solution to some of these pain points. And actually, it's not only me who sees the importance of digital health. Let's have a quick look into the WHO, the EU, and the German policy papers, which show trends and priorities in public healthcare and digital health. WHO has published a global strategy on digital health 2025. The final version of this policy was announced during the 73rd World Health Assembly. In the European Union, the digital single market strategy was announced 2018. But we have a lot of initiatives on a European level. Just to mention a few of them: the EU pharmaceutical strategy, the European health data space, EU 1 million genomes, or exchange of cross-border information with e-prescription and patient summary. The German government published a very interesting Global Health Strategy 2020 to 2030. This paper was announced on October 19th, so just a few weeks ago. I chose this policy as an example of a national strategy because it presents a holistic approach to the government, to the environment, climate change and public health in a very interesting way. This paper is also consistent with the WHO and the EU agendas. So what about Poland? We can see that states are increasingly committed to defining coherent public health and pharma priorities at the European level. I'm very positive about selected initiatives made by the Polish government bodies and the Ministry of Health in terms of e-health solutions, e-prescriptions, e-sick leave or e-referral, which will be implemented in January 2021. We are waiting for the new healthcare system development strategy because we believe that we really need a more comprehensive approach to digital health and the pharmaceutical industry in Poland. We see various bottom-up initiatives from the level of business or associations, but we need a strong dialogue with the government. I'm there personally very proud of initiatives made by us through Digital Poland, where Polpharma is a founding member. Now, what do all these strategies have in common? I went very quickly through the WHO, EU, as well as national strategies re e-health and public health. For me, the most important thing is that we can find one common line across them. Do you know what do they have in common? 3 points: prevention, patient centricity, and collaboration. Still, the healthcare industry is focused on treating illnesses. It's not yet ideal from a patient and not effective from a payer perspective. But it seems that in the new reality, during and after the COVID-19 pandemic, not only governmental institutions, but also individuals will attach even more importance to preventive measures. Seeing these actions as a chance not only for well-being, but also has the tool to avoid serious health and economic consequences. Furthermore, the introduction of digital tools on a larger scale in many countries, like telemedicine with well-being advice, applications regarding prevention of contamination, and health parameters monitoring can rebuild our everyday reality and healthcare provider system. Historically, public health bodies have dealt with populations as a whole. Nowadays, the approach has changed, and we're not talking about a one-size-fits-all attitude. The power of predictive and pre-symptomatic prevention comes from empowering citizens to look at their well-being from their own perspective. It opens plenty of doors to make positive changes in citizens' lives, in different ways, not as we have done so far. This approach also works very well with new movements in health insurance systems to pay for performance systems, as you see in the United States and the United Kingdom. Payers are increasingly focusing on models rewarding results and maintaining health rather than sick care. Data and digital technologies can help governments to identify groups at risks and change behaviors of people before they become patients. From the perspective of pharmaceutical producers, we can expect that a personalized approach will mean not only personalized care, but also personalized prevention and public health. We can also find very interesting data in the PricewaterhouseCoopers report, Driving the Future of Health. It was published in 2019, so before the COVID-19 pandemic. But I believe that COVID-19 even triggers the trends prescribed in this report. PricewaterhouseCoopers asked 120 C-level executives from global biopharma companies how they estimate the global healthcare budget in 2030. What are the findings? The global healthcare budgets will be under higher pressure, only 10% growing in 2018 to 2030 by 10%, with an increasing role of prevention, which should be 9% of the total healthcare budgets in 2030, and digital health seen as 8% of those budgets. These new value pools will also redefine other segments of healthcare, like care and medication. As I said before, in terms of spendings on medications, governments will more often look for personalized medicines as well as early stage and generic drugs for more manageable conditions. Also due to the significant growth in patients with access to healthcare, spendings per patient, including medications, will fall, with an increasing role of preventive tools. Being a branded off-patent drugs producer, we want to increase access to medicines and increase people's quality of life. This is why I think it is important to put a renewed emphasis to accompany the patient during the whole patient journey and switch from a pure treatment approach into comprehensive solutions in every phase. I believe that understanding the patient journey and driving the pain points can drive the development of meaningful solutions for the patient. Such an approach leads to patient centricity. Why so? Let's see what kind of features will a patient of the future have. He will be well informed, he will get anywhere care, he can exercise control, and he's more independent and is more focused on prevention. This will give a patient more power to exercise control of his and their health during the whole patient journey. Also, patient centricity is often used as a buzzword. But what does it really mean for us in the pharma industry in practice? I think we need to understand the patient needs better to deliver more personalized solutions. I truly believe that in combining medication with digitally supported treatments, we can deliver more personalized value for our patients. To act fast and be effective to answer those big challenges I mentioned at the beginning, we cannot do this by our own. The future of the healthcare pharma industries is in collaboration and partnerships between different stakeholders. There are different areas where we can work together, but I want to focus just on two of them: interoperability and patient data. With the growing amount of applications of digital technologies in healthcare, one of the major challenges for all healthcare stakeholders is to ensure interoperability between different digital and human activities, that ultimately deliver the best outcome for the patient. It is critical for synergistic management of information. In particular, rational management of medicine supplies to avoid shortages could be applied once we have broader information on stocks and geographical gaps in provision. Along with technology, interoperability is constantly improving and adapting to match the growth of technology in the healthcare sector. Patients may have a number of specialists and other healthcare options, which means providers need to be able to successfully transfer that data in real time for peak care. While seamless data flows are the foundation of interoperability, it goes beyond just data exchange. Interoperability is also crucial on the level of harmonization and interconnection of various healthcare services. A clear view for an interoperability strategy aligned at international level will be key for faster development of digital health that would improve the patient outcomes in a safe manner. All information about patient health, including information collected during patient interviews, diagnostic activities, treatment delivery, monitoring health parameters, questionnaires, etc., should be the property of the patient and should be available to the patient and anyone authorized by the patient in any of the systems where such data is collected. Patients' medical data is very sensitive data, so it should be very well secured. Access to patient data is a particularly important aspect of coordinated healthcare. It is important to create standards of anonymization and pseudonymization where exchanging patient data, which will preserve their privacy. Each interested party should have access to anonymous data sets for concept testing and research. So to sum it all up, I leave you here with the closing points. And if you ask me who would be successful as a player on the healthcare pharma market in the future, I believe that the winning player will be the one who best understands the patient journey, adjusts its business model into patient centricity, and actively supports it by cooperation through partnerships. Thank you all for today, and I wish you all a great time during this event and a lot of fruitful discussion. See you on the next forum, eZdrowia, next year. Thank you very much.